Really excited to teach this class. We have actually taught this class for years, and it constantly morphs and changes because as new research comes out, NSA is constantly being shifted and changed as we have more research. And so this class, if you've attended it in the past, it's probably changed quite a bit since you have. But anyway, our class is called Phases, Stages, Levels, and Biofields. And I wanted to start out just by giving you a very brief overview of NSA care. And so if we look at this, NSA Care was founded by Dr. Donald Epstein. It's been in the process of development for over 40 years. And we say the process of development because it's, again, as new research comes out, it's constantly being advanced and shifted and changed as we know more about the nervous system and how the nervous system processes an input of information. It was originally taken as components of some of the most successful chiropractic techniques. And so techniques that were maybe even, 50, 60, 70, 80 years old. It took that information from those techniques and networked it into a very specific system. And we're going to talk about that system and how it applies to the changes that we get, because how we use that is so key in terms of the result that NSA is able to provide. And it's just the understanding as well that NSA is a tonal or a neurologically based technique. So when you think of traditional chiropractic, which most people in our office have, maybe that's their thought about what chiropractic is. When they think about that, they're looking often, and we were taught in school, in chiropractic school, is to look at very specific areas of misalignment. But in a tonal or neurologically based technique, we're looking at the whole system, how the whole system functions, meaning we care about the health of the entire thing, the entire spine, how the body is working together. So, and I'll talk about this more later, but a client may come in and they may say that they have low back pain, but the patterning is showing that it's coming up, it's coming from maybe C1 or C5. And so we're going to work on that and really get the whole system to respond versus just going to an area that hurts or just trying to shift or move one thing when maybe something in another part of the body is not allowing it to move. So we need the whole system to work well together, which is so much a part of being a tonal chiropractic technique. So when we're working with NSA, our whole goal in terms of shifting how your body functions is to decrease adverse mechanical cord tension, meaning the amount of tension that's on the nervous system. So you think of like when we look at an X-ray, we may see like twists in the spine. We may see there's curvatures. We may see areas that are straight that should have a curve. And so we're looking at what is creating what is called AMCT or adverse mechanical cord tension, but through that process of NSA, we want to improve the function and the balance and the positioning and the tone of the entire system. We want to allow the nervous system to actually form new neurological pathways and new neurological patterning. So when you think of how the body was often like, most people, when they come into our office, have been in the same type of patterning within their nervous system for probably a very long time, maybe 20, 30, 40, 50 years. And so we're looking at that pattern, and that pattern is based on the brain sending very specific signals to the rest of the body. And it's been using that signaling pattern for often a very long time. And we're trying to shift that. So we're allowing the brain to actually form new pathways, new neurological pathways, so it can function in a new way. Pretty exciting how much the nervous system can actually change and adapt over time. We want to really increase the parasympathetic side of the nervous system, which is allowing the sympathetic tone, or what we think of as fight or flight physiology, which I'll talk about more. We want to shift that so we have more parasympathetic, or at least a balance between parasympathetic and sympathetic. And we want to improve someone's healing capacity with that process. We want to really increase quality of life, which we're really going to hit on and how that looks. We want to improve body awareness. So I want you to be able to feel your body. I want you to be able to feel how your body is responding to certain situations or stressors within your life, because it's information that is going to allow you to change and adapt in your life in really healthy ways. And I want to allow your brain to have more blood flow to the frontal cortex, which will happen every single time you get adjusted. There's more blood flow to the frontal cortex of the brain, this part of the brain, which is our higher brain function and our decision-making capacity. So there's a lot of goals that we have through this process, but the big one The big one that is really life-changing for people is to create resiliency within the nervous system, to really improve the adaptability of how someone functions and how they handle stress. Because when we get to that, that's typically like getting to the root cause of what's creating someone's life to be the way that it is, and maybe something that they want to change. We have to have that resiliency and adaptability within the nervous system. So that's a big one that we're going to hit on because it affects everything else in someone's life, and it allows them to have the awareness of what's working and not working within their lives. So we use in this process phases, stages, levels of biofields to meet the goals. And it's really the detailed system of analysis that allows us to get the results and the shifts in the mind body that NSA is able to provide. So most people, when they come in to see us, start care in something called defense posture. And what that means is that they're stuck in fight or flight physiology. Their bodies may have old tension patterning that's from injuries or high stress parts of their life, or maybe they had a stressful childhood or trauma that happened to them, but their nervous system is stuck in patterns that their body used to create a fight or flight physiology. And it affects their quality of life. It affects their perspective. It affects how they see the world. It affects their ability to thrive and to heal. But it also affects their organ systems, the information that their organs are getting from their brain to be able to optimally function, and how it appears. What we see when we're working with someone and we know that they have high fight or flight physiology is that their muscles will appear very tight. They'll appear very guarded. They'll have often arthritis in the spine. They'll have areas where there's not the proper curves in the spine, where they're very flat. When you look at that person and they're laying on the table, there may be very little to no breath that you can visibly see moving through their spine. So when you think of someone's breath, you should see their whole body move with breath. But when in fight or flight physiology, that's really constricted. So we'll see all those things when someone's actually laying on the table. On an X-ray, we may see a lot of arthritis that's developed in the spine because there's not that freedom of movement and mobility within the body. If I can show you in my posture, and I'll show you here in a cartoon here in a second, but it'd be like this. And so that's kind of dramatic, but you'll see that type of posturing in someone with high fight or flight physiology. And so this is the big piece of it, is that the shape, the position, the tension, and the tone of the structures of your body are an effect of the experiences that you've had within your life. So really what that means is that your biology or your biography becomes your biology. And at NSA, we're really working on shifting the function and the shape of the nervous system. So how it's firing, allowing new patterns to form, but also how it's shaped. And so meaning when we talk about that, I'm referring to your brain, the spinal cord, and the nerves that exit the spine and go to every single cell within your body as they branch out. The nervous system is what controls and coordinates every single function within your body. It's your thinking and processing center when we refer to our brains. So the brain is the thinking and processing center, where the spine is actually the emotional producing and processing center of the nervous system. And the shape of the spine then, like how someone's spine is shaped, becomes their filter, and it shapes their perspective. So here I've got this cartoon of Charlie Brown with this quote: "This is how I stand when I'm depressed. If you're ever going to get any joy out of being depressed, you have to stand with your head out and your shoulders slumped." So that's kind of a dramatic look, but most people aren't that aware of, if they are depressed or anxious or angry, how that's affecting their posture. Because your nervous system is constantly responding to not only what's happening externally, but also the thoughts and the emotions that you're feeling. It's all connected, but the spine is the big processing center of that. And so your nervous system is your filter, and the shape of your spine then affects your perspective. The majority of the limbic tissue of the nervous system, which is the part of the nervous system tissue that actually senses emotion, is in the dorsal horn of the spinal cord. So that's where the information is actually going to the brain. So it's taking all of this emotional information and inputting that information to the brain. The health of your spine then is directly correlated to your well-being and your body's perception of its environment. And so I really refer to here this book by Candace Pert. Candace Pert is a neurobiologist, and she wrote this book called Molecules of Emotion. And it's fascinating. Her work was so close to winning a Nobel Prize. And she was a fascinating researcher, but what she discovered was that the tensioning pattern, how the spinal cord has tension on it, affects the nervous system as it affects the cellular receptors. Every single cell of the body has receptors on it. And when there's tension on the nervous system, it's affecting the shape of those receptors. And that affects what types of neurochemicals can actually bind onto the cells of our body and produce specific emotions. What she found was that when there's increased tension on the spinal cord and the spinal nerves, it actually increases more negative producing neurochemicals to bind to those cellular receptors. And as people move, so as we move through NSA care and we take that tension off of the nervous system, it actually allows the shape of the receptors to change, the shape of the cellular receptors. That allows many more positive emotion producing chemicals then to bind on to the cell wall. And so basically what that means is that the less tension there is on the spinal cord, the higher quality of life of the individual, the more emotional range that they have, especially into the more positive emotions, and they have a greater sense of well-being. Okay, just want to check here. So the dorsal horn, I wish I had a good picture, Megan, but I can show you in, I don't have anything in here, but I've got a great physiology book that I can show you that piece of what it looks like in a picture of the spinal canal. Okay. So the big stuff, so we're going to just go through, I want to make sure I didn't miss anything. Okay, so in NSA care, when we get to this, there's a lot of research that correlates with the increase in the surge of increase of well-being. And so when we go through this piece of it, this is a study that assessment of network spinal analysis in retrospective and prospective research design formats using a self-reported system of health and wellness. So I want to go into this and what this looks like, but this was a study that had over 2,800 participants. It's one of the largest studies that's ever been performed on any natural healing modality. And what they looked at is they took the concept of wellness and divided it into different categories. So they looked at physical pain, and you can kind of read through what that might look like. That also had to do quite a bit with like the immune system, the regulation of the immune system, but also a lot of like that tension and stiffness and headaches, that type of thing. But they looked at mental and emotional state, response to stress, and improved life enjoyment. And then they looked at improvement in overall quality of life. And what you'll see is that in terms of physical pain, 72% of people had significant results. Mental and emotional state, 66% of people. Improved response to stress, 66% of people. And improved life enjoyment was a good 70%. So when you look at this, I want you to be aware of all the different things that are changing as your nervous system shifts. You should notice that there's an improvement in mental and emotional state. And that doesn't mean that everything's perfect all the time, because there's definitely things that people feel that maybe are sometimes uncomfortable as they go through the process. But there's a healing component to that that's really important to acknowledge and be able to move through, because on the other side of it, there's usually a lot more joy, a lot more peace, a lot more sense of well-being. And then improved response to stress, that adaptability, resilience piece of it. You think of most people when they have stressful things that happen to them, they often go into different behaviors that maybe are not their favorite, but they're used to dealing with that. And maybe maybe people will like choose to have a glass of wine when they don't really want the effects of having a glass of wine, but they want the stress relief from that. And when they start to be able to have this improved stress response, they have an adaptability or resiliency. So they're not going into the negative parts of that. They go into the positive pieces of how they can handle stress in a more, in a healthier response. Then improved life enjoyment. So they are able to listen to their inner feelings. They're able to have more positive feelings about themselves. So there's just so many pieces of this that improve as people go through the process of NSA. The piece of that I think is so fascinating, and it really shifted the term wellness in terms of research, but that there was no cap on the results. So they studied people that had been in care for a period of like 3 months, and they studied people that had been in care for over 3 years. And what they found is that there was no cap into how well or how much someone could respond. So I think that's a really important thing to go through, because I think in today's world, we kind of think we can only be so well. There's no cap on it. I want you to be able to really go into, like, I could be as absolutely well as I choose to be. And the more adaptable my nervous system is, the more of results that I can get for that. We also there's a significant increase in wellness that's reported with the formation of what's called the respiratory wave, which I'm going to go through here in just a second. And the reason I put this specific graphic up is that there's been a lot of research that's been done with electrical signaling. So the last study that I went through, this study was done with the University of Southern California in their neurobiology department. This study was actually done at the Electrical Engineering and Computer Science program of University of Wyoming, and they actually charted the electrical signaling changes that happen as the nervous system becomes more complex. So when you look at this graph, what you're looking at is the jump between level 2 of care and level 3 of care, which we'll discuss in a little bit, but there's an increase in the complexity of what's happening within the nervous system, and that has been studied extensively. The awareness of it is the key, though. So when we talk about this respiratory wave, the awareness is going to be the key for everything. So meaning that if I see something happening for a patient, I can tell them. But if they don't feel it, there's not the same level of shift or change within the body. So we're going to go through all of this stuff in a greater detail. There's also a lot of research with network as a central pattern generator, the network spinal wave, which is just kind of cool, because a central pattern generator is like the motion of walking, the motion of swimming. We have lots of swimming pictures in our house, so I chose those because everyone knows what walking looks like. But for swimming, I mean, all of those things, your body can naturally go into this very coordinated motion. This does the same thing with the network spinal wave. So we're going to go through exactly what that looks like in the development of it. But tons of research clients. I work with a lot of engineers in this office. We work with a lot of people from the mines, School of Mines, and teachers and professors and students. And so it's always fascinating. They want to know the research. So there's a lot of different research, and some of it is actually related to engineering, which is kind of cool. So some of the things I just want to go through that I think is one of the reasons that we get the type of changes that we do with NSA is the whole concept of acknowledgement. So when you think of this, with NSA, our goal is to not just take away what is bad. If you just take away a symptom, I think most of our clients know this, but the body-mind will just speak more loudly until it's heard. And so with an NSA, what we're actually doing is drawing attention in the nervous system to what is working, and we're actually allowing that to work in a more efficient way. And so if you think of this whole kind of concept, we allow the brain to find it, to heal it, and to reorganize it. And so that's a big part of why we get what the kind of results that we do. But it also involves the whole concept of like, you have to feel it to heal it. Like, you need to actually be okay with feeling your own body for NSA to get the full effect. Like, when you can feel it, your brain can acknowledge it, and we can go into a place where the body is stimulated into healing. So we also integrate the old patterns, the painful problems. We integrate the trauma into a new, highly organized system. So please check out our blog articles. They're on our website, www.bodyandbalancechiropractic.com. I've written extensively about this. There's so many different layers of concepts within NSA care, and we're just touching briefly on some of them tonight. But there's so many pieces of reorganizational healing. This month's blog is on a poor energy state versus a more high energy state. We talk about the concept of structure, behavior, perception. We look at internal versus external, which kind of ties into some of the things that we'll be talking in tonight, but there's so many more layers of this process that are out there. So what does it take in the process of healing? It takes time, it takes consistency, it takes the willingness to experience and listen to your body instead of just cover it up. It's breathing, allowing your body to breathe into the awarenesses that you have. Allow your body to move. I'm going to show you videos tonight that we just filmed of the development of the somatopsychic wave and what that looks like. But it all takes place because if someone is allowing themselves to move. And so we kind of, most of us probably grew up in a culture where for kids, it was like, it's better to not be seen or heard. With NSA, we really want you to move. It's okay to express what your body's feeling through movement. And so you'll see some of what that looks like. And then be open to other self-care practices. So in that big research study that we looked at, there was the one that was done by the University of Southern California. They actually looked at when clients reached a certain level of wellness, they participated in so many more healthy activities because they were healed. So if you think of it like because they were in a healing process, so as they became healthier, they wanted to do more things for their health. It's kind of in our culture, we often think of it in the opposite way, in which people think, well, once I'm or I should do this in order to be better. It's kind of the opposite. Like once your body is functioning better, you will feel like doing more, and your health will continue to add more and more good things to it. It's like kind of like habit stacking. You do more and more good and your body responds better and better, but it starts with being able to function at a higher level so that you can integrate those good changes. So I'm going to go through the levels of NSA care. So the first part of this is that we make very specific, very gentle, brief contacts within the spine. We make those contacts specifically in what are called the dural attachments of the spine. Those are going to be within the neck and they're going to be within the sacrum. So when you look at this picture of the spine where the nerves are exiting and what they call the cauda equina, that is where we have dural attachments. So we're making contacts specifically on those dural attachments to affect the connective tissue and the tension that's being placed on the spine. The strategy in level 1 of care then is we want to dissipate the spinal cord tension. We want to shift how the nerves are firing, which is like repatterning. We want to help to reconnect the brain and the body and increase the body and the emotional awareness. So all of that is critical through this first part of the process. We want to really decrease fight or flight physiology, and we want to activate the parasympathetic side of the nervous system that can create that healing environment in the physiology. And in level 1, we really want to teach the body how to dissipate tension for itself. So what that means is people in care will often say like, gosh, I just feel like I need to breathe more or I need to stretch. Listen to that. They'll often notice I'm in a stressful situation and I feel like I just need to get up and I need to move or I need to stretch. Listen to that. That is your brain communicating with your body in a totally new way, which is really cool. Level 1 is not only used to build the foundation of neurological strategies for the body, but it's also used in times of high stress. So even when I go through, like when a client develops level 2 or level 3 neurological strategies, that's awesome. But we might need to go back to level 1 during times of high stress. So it's not like just we're in level 2 or we're in level 3. We move back and forth between the levels depending on what's happening within their lives, within our lives, and also what we're processing at that time. What are the other influences that are going on? So it's not like we just achieve level 3 and we stay there. It's we move and it's a fluid process to honor whatever's happening in that person's physiology. So in level 1 of discovery, we often call this discovery care because the brain has used the same signaling patterns for often years and years and years to communicate with specific parts of the body. But by using the phase analysis system, which I'll talk about in a little bit, as well as x-rays, and we use the EMG tests. We have thermography tests that show us neurological, like patterning, how the body's storing any kind of neurological tension. We can determine what kind of stuck patterning is present and cue the brain to move into a new signaling pattern. And so the big part of this with level 1 of care is we want to develop the respiratory wave, a somatorespiratory wave. And what that looks like is the whole spine should move from the very bottom at the coccyx to the very top of the spine with breath. And so again, awareness is critical. So if I can see it, but someone can't feel it, we've got to get them to the place where they can feel it. And a lot of times that has to do with just, we need some repetition so we can decrease the amount of neurological tension in the system. And that will allow that respiratory wave to be felt as well. We want to increase the blood flow to the frontal cortex of the brain, improve the higher level of thought and decision making. The cool thing, this has been studied multiple times with functional MRI, but the NSA adjustment process actually increases brain efficiency. So pre-post adjustment, there's typically about a 3,000% shift in terms of the amount of activity that's happening within the brain. So things become a lot more efficient when we get to the place of, especially with the development of the respiratory wave, but things become more efficient within the nervous system during the adjustment process. This is so critical because we're starting to see multiple journals are now showing that the first step in the healing process in almost any condition, whether it's an autoimmune condition or it's a multi-system disease process, meaning something like heart disease, where there's multiple organ systems that are being affected, or something like a kidney disease or cancer, anything like that, infectious disease process. One of the most helpful things is to rebalance the function of the nervous system, because when the body is really stuck in stress physiology, healing is very difficult, if not impossible. So we really want to get that process of rebalancing the nervous system and allowing things to function at a higher level and dissipating the stress physiology. I actually wrote all about that in last month's, I believe it's out right now, actually. It's called an article all about the concept of dysautonomia, which is when the nervous system is out of balance and how important that is in healing just about any kind of physiological condition and mental, emotional. Okay, so the respiratory wave, when we develop that, then it actually allows for spinal fluid to move through the spinal canal. It brings nutrients to the disc and the nerve. It actually, the movement increases when we start to get the respiratory wave. We have an increase in the mobility of the spine. The respiratory wave increases. It's like the first step of moving towards reorganizational healing, where the whole system can learn to work in a new way. When we start to get to that point of the respiratory wave, people will often feel hungry, tired, thirsty, but what that is that they're feeling is the activation of the parasympathetic side of the nervous system that's putting them more in touch with the needs of their body. So it's actually a very deep healing state, and I love it when people feel that. So it's temporary, it doesn't last forever, but it's really important to listen to that because it's such a good sign that the body's really moving into that deeper healing state. A lot of people will feel sore. And a lot of this, the part of that is that when we start to increase the mobility of the spine, we're actually decreasing the amount of tension that's in the bone, that's stored in the bones of the body. And when you start to dissipate that tension, your muscles actually have to take over. They have to do something with that tension and work in new ways. So people will say to me all the time after their first couple of adjustments, especially like, gosh, I feel like I did a whole new workout that I've never done before, and I feel all these muscles in my body that I'm not used to feeling. That's a big part of the nervous system, decreasing the tension in the bone and using the muscles and again, new patterning. And we often will see signs of detoxification. So people may notice that there's just a shift in their digestion, or they're saying that I have to go to the bathroom all the time, like I have to urinate all the time. That is a result of detoxification. All of those things are very temporary, but they are signals of how the body is shifting and changing through the process. Okay, so then we go through, so in level 1 of care, we want to develop that somatic respiratory wave and the awareness of it. But by the end of level 1, so we're going to talk about, we have this better communication network within the body. We have improved alignment. You typically can see those changes on x-ray. If we've taken x-rays, we can see those changes before and after. We have less stress. We have less of a defensive state. There's more parasympathetic activity within the nervous system, more of a healing state, and usually a much calmer mind that goes with a calmer body. And so I filmed this video. I'm hoping everything works for us here so I can show you, but this is me adjusting Dr. Scott. And I'm going to show you in this process what I want you to really pay attention when I make specific contacts on his spine, what you see. because you should be able to see the increase of breath moving through his spine. What I'm making on this video is level 1 contacts. So when I say level 1 contacts, again, they're on the dural attachments of the spine. I believe in this example, we show them on the neck, but they're very specific, very brief. I'm actually tractioning as I'm working, meaning I'm figuring out how the tension is stored within the body, and I'm moving his spine. I'm tractioning his spine in that direction of how the tension is stored to help his brain find that tension. So I'll show you this. Okay, so here is a level 1 contact, very specific, very brief, but watch what his spine does. So that's how I want your spine to be able to move when you breathe. But I want you to be able to feel it moving like that. Okay. So I will chat questions here in just a little bit. I'll keep moving, but if there's any questions that people have about what that looks like, but that would be a typical goal. When I see that kind of movement in someone's spine, we've typically worked to get there. Not everybody, some people have those strategies right away. But again, I want to see the bottom of the spine to the top of the spine move. And now I'm going to go back and check his tension levels, which I'll walk you through that in a little bit. But I'm going to see what kind of effect that has made in his neurological tension, if his leg length has shifted. So there's all kinds of parameters that I'm looking at to see how his body took in that contact and took in that information. But the development of that respiratory wave is a big step in knowing that he's ready for a new, like a higher level of care. Okay, so when I see that respiratory wave, I know we're moving into level 2. And level 2 of NSA care is a higher, like there's more organization within the nervous system. So if you think of like that graph, that electrical signaling graph that looks kind of crazy, but that we would see things kind of jump up to a new level of organization. There's a higher level of complexity in how the nerves are firing and signaling within the body. So with time and repetition of adjustments, the nervous system becomes sensitized at the site of the dural attachments of the spine. It allows for a shift in the nerve signaling patterns to then start to create the somatopsychic wave. Timing of the wave is dependent upon how much stress is in the body. And what I mean by timing is, does this wave develop in 3 months, 6 months, a year, 2 years, 3 years? It really depends on the amount of stress that's stored in someone's system. And this is kind of interesting because it's actually been studied quite a bit by psychologists, and they actually look at when people have higher levels of trauma within their body, or like things that they've experienced throughout their lives that are more traumatic, they often will develop the somatopsychic wave more quickly than people who have not had experience of a lot of trauma. But it also, what I've seen it depend on someone's perception of movement. Is it okay to move? Is it not okay to let my body move? It has a lot to do with their personality. So like Scott's spine, I remember when we started NSA care, he had big waves that would move through his spine pretty quickly. But Scott is someone who leads with what we call behavior. So he just goes for it. He just kind of does it. He listens and he does. I'm what they call highly structured. So I like to kind of work on step by step. And that's how I learn things. So there's that piece of it in our personalities as well. So, but the thing about it is just to pay attention to your body. And if you feel like you need to move. And if we can see like things starting to develop within your body, we're going to actually coach you to help that movement form the somatopsychic wave, because it's such a powerful experience when it happens. The somatopsychic wave, again, it depends on awareness and an individual's participation in the healing process. So I do have clients that I've worked with for years that literally check out on the table. Like they just relax so deeply. But usually there's a pretty high stress level that's associated with that. So they're less likely to move on the table because they're so relaxed, and that's okay. But I have other clients that like, gosh, I want to form the somatopsychic wave. So they're paying attention and they're listening to their body and they're moving or stretching however they feel like they need to, which I'll show you this in a video in just a second. So as the body moves towards the creation of this wave, the spine is addressing deeper levels of healing and change. It's a very deep level of reorganization that happens with that. And it typically, tension will typically build for the formation of the somatopsychic wave, both emotionally and physically. Some of my biggest life changes happen as the somatopsychic wave started to develop in my body, the awarenesses that I had, the changes that I was able to make. So it can be extremely powerful as this starts to develop neurologically. The increasing complexity of the somatopsychic wave has been studied with electrical engineering, which I referred to before. Excuse me, level 2 is divided into 2A, 2B, 2C, and each section has its own characteristics or skills that the nervous system is learning. So that means that, so if I'm adjusting one client with 2B strategies and another client with 2B strategies, they would have that similar electrical signaling patterning happening through their spine. The frequency of that would be very similar. And so typically, again, the development of the somatopsychic wave really has a lot to do with gains in personal health, well-being, just there's the strategies that someone is using, but also someone's thinking, their perception, life changes. Like there's just a lot that can happen, especially emotionally, as the nervous system gets to that level of complexity in terms of its adaptability and movement. And so the thing to realize is that there's no right or wrong. Wherever someone's at is really where they need to be at, but both levels 1 and 2 are creating an advancement of the nervous system. But I'm going to show you what this level 2 process looks like. So this is a video of me making now the transition from a level 1 contact to a level 2 contact. So let's get to this. Hopefully everybody can see that okay. So I'm holding a level 2 contact here, or will. So I'm holding the contact for longer and this is a level 2A contact. So the somatopsychic wave actually starts with a stretching motion of the spine. And so you'll see him, he's kind of lifting up his neck and he's stretching it, and this feels so good. But the key is that he's stretching it in a very specific way. He's also moving into what's called oscillation, which is, again, the beginning of a somatopsychic wave. So you can see the breath start to move more, but you see the stretching response integrating with the breath. So that right there is a somatopsychic wave. I have clients ask me all the time, is he doing that? Am I doing that to him? He has full control over his body. But again, the dural attachments, like the nervous system tissue in that part of the spine and in the sacrum as well, has been sensitized to be able to basically respond to that. So he feels the need to stretch, but he's also doing it in a very specific way that's allowing him to release tension where I need him to, based on what I found in the exam process. So, and I'll walk you through that in a minute. Okay, and again, if there's any questions, feel free to type anything into the box. Okay, so we're gonna go to the next part of this. So you'll see, and I'll walk you through how I determine what needs to happen here in just a second. So we're again making this is a level 2 contact. His body is actually building up some tension in the area that I'm working, and he's dissipating that tension by creating what's called oscillation. So he's stretching and he's moving and he's allowing his body to move in a very specific pattern. So hopefully you can see that right in the neck. And now I'm going to have him sit up. So that is the transition between what's called 2A of network care into 2B of network care. And this is 2B. So 2B, I'll often have someone sit up. In both level 1 and the early level 2 of care, we're getting both the neck and the sacrum to start to move in more complex patterns. For level 2B, we're actually addressing the chest or the thoracic spine to be able to open and expand. So when you look at this, it's much easier to get someone's chest to open and expand when I have them in a seated position. So here I'm going right to that same level of contact, and I'm actually doing what's called a clavicle stroke, which when I move my hands over his chest, but I'm like basically stimulating his nervous system to open in the thoracic spine or the mid part of the spine. But that, again, you're seeing this very specific level of movement and oscillation, and that's what we're trying to create. That's the somatopsychic wave. Okay. So this is what is called 2C of network care. So now when we've had someone sit up on the table, we've had this expansion of the chest area. Now we're going to further stimulate that even more. So this is a very complex somatopsychic wave and what that looks like. There's a huge range of motion of the spine. The spine is very adaptable. I'm very specific in where I want his spine to move. And I'm actually going to start to use other parts of his body now to create more awareness and connection. So here I'm actually using his feet to specifically stimulate parts of his neck, same areas between that C4, C5 area that I was working on. And I'm directing his energy into the chest and into the neck. So I'm basically cueing all those areas of the spine to be able to form a very complex pattern and be able to work together. So the amount of movement and adaptability in the spine that creates is pretty fun, pretty incredible. So with network spinal analysis, what you're seeing is very specific. Many of the changes are very dependent upon the analysis system that we use. And so I'm going to talk about that here in just a second. Your body is leading us to those changes. So we work as a facilitator, but the analysis process is really what's guiding us. But also, when I say that we're working as a facilitator, you are truly the one that's doing the healing. You are the one that's doing the changing. I am cueing your nervous system to create those changes. So I want to go through the phasing system. And so basically every time we do an adjustment, we're measuring parameters. And so I'm going to show you the variety of parameters that we can measure. The first one, I'm actually feeling the movement in the spine. So when I run my hands, let's see, so as I'm running my hands along the spine in this video, I'm actually feeling for the tone of the bone of the body. So I want it to have a give. I want it to have flexibility. The next thing you're going to see me do then is move my hands over the muscular system of the body. So here we go. So I'm going to go along. Now I'm feeling how the muscles are responding to the areas that have higher tension within the bone. I'm feeling for any areas of inflammation or like a stickiness to the tension or the tone of the tissue. And now I'm checking neural tension. So when I move the heels like that, I'm actually not just checking for heel flexibility. The tendons of the body are what store neurological tension. And so when I move the heels of the body, I'm actually feeling where tension is stored within the nervous system. So the very upper part of the heel really corresponds to the cervical spine, where if I can't get a lot of motion in the lower part of the heel, it's corresponding much more to the lumbar or the pelvis part of the spine. So we're looking at that piece of it, and that gives me a ton of information. And I'm also looking at leg length. So here I'm still measuring heel tension. This is all giving me information about what I'm going to work on. And now I'm having him turn his head from side to side, and I'm watching what his leg length does as he moves his head. And that actually tells me is what's happening in his spine related to more of what's happening in the like me, even if he has like a knee issue or a pelvic issue, is what's happening or throwing his spine off balance happening to something that's going on within his neck, or is it happening to something that's going on within the pelvis? So I'm gathering all of this information that's helping me understand exactly where I need to make contacts within the spine. And also just the tone of where his body's at. Is it in a really highly stressed state? Is it in a calmer state? And I get to know people's patterns. And so that is just one of the ways that we can really start to feel what's going on in the whole system and how are we going to address whatever that current state is, but keeping in mind what's happening, what are the longer term patterns that I need to be addressing between what we see if we took x-rays or if we took we have EMG testing, thermography testing, all of that. Okay, so what I was just analyzing with that process was what phase was the body in. And the phase is like the tone or the frequency of the nervous system, what it's resonating at. Typically, people have a dominant phase that's formed with how we initially respond to life. So when you think of traumatic situations that you dealt with, or just things that you may consider high stress, your body went into a specific pattern. And that pattern then is typically when your brain finds something that works, it will use that same pattern over and over and over again. That is what forms the phase of the spine, or the shape of the physiology of the spine, whether there's a curvature, whether things are really straight, whether the head is forward, whatever it may be. It's that response to stress over and over and over again that the brain learned that's shaped then and is what we see in the spine. But it's a tone. And when we talk about that tone, there's an emotional correlation with that. So when someone has a phase 1 tone, that's usually a lot of stuckness within the pelvis, but there's a correspondence in phase 1 to the thoracic or the mid spine. And what that patterning, it's the lowest kind of a frequency that we work with, but that corresponding stuckness has a dominating consciousness, and the dominating consciousness of that pattern is stuck in the past. Having this viewpoint of whatever happened in the past, we're looking through that lens. All of us have this patterning. We work on it all the time for everybody, but it's a big piece of where people, again, we want to get more flexibility. And I'm going to go through what these phases look like in, how to describe that, in like level 1, but the change, the energy of it changes as we develop higher level strategies. So we have more resiliency and more adaptability with those patterns as we get to higher level phases. So we'll talk about that, or higher levels of care. So we'll talk about what that looks like. Phase 2, so phase 2 is when we're doing a leg check and we have someone turn their head, and when they turn their head, their leg length evens out very quickly, and that is a C1 pattern. So when we have stuckness at C1, that is the dominating consciousness of, gosh, it's such an overwhelm of the nervous system. How will everything unfold? There's a constant busyness. How are things going to get done? How are things going to work out? That's a C1 patterning. That is when we have someone, when we do a leg check and I have someone turn their head and their leg literally slowly come down as they have their head turned and even out. So it's like this, it's literally will be this kind of a slow release of the leg length to even. That's a C5 pattern. And the C5 pattern is the dominating consciousness is there's fear in the system, but it's expressed as rage. So it's all of these things can change over time, but that's the kind of tone that's within the nervous system. The piece of that to realize is that physiologically, when the brain senses that there's a lot of tension at C1, that's right where the brain stem becomes the spinal cord. So of course the brain is going to see that as something it needs to protect. When C5 is the main issue, that's the area where the spinal cord is the most narrow, or the spinal cord is the thickest, but the spinal canal that holds it is the most narrow. And so again, if there's inflammation or stuckness in that area, the brain is going to perceive that as trauma. It's expressed in different ways. And so then we go into phase 3. There's either a flexion extension kind of pattern, like a forward bending kind of a pattern of the pelvis, or a rotational pattern that's happening within the pelvis. And the dominating consciousness of this is a question of self-worth, especially in relationship to specific roles that define identity. So often with a phase 3 patterning, we'll see someone switching jobs all the time, or they're not happy with their job or their performance, or they never feel like they're quite doing a good enough job, or they're questioning relationships, or they might questioning their parenting. But there's a constant kind of a tone or feel of, is it good enough? Am I making the right decisions? Or I'm not happy in this, or there's just this questioning of, that's the tone of phase 3. Phase 4 is a pattern where it's the C2, C3, the mid part of the cervical spine can become very stuck. And so the best way I can describe that patterning is when you're looking at someone's physiology, they might have breath move through their lower back, but when they get to that mid back area, upper back, there's like no movement of that. The kind of tone of that is that there's a domination of thinking and a very little feeling. So in someone's life, it may have really developed because of it wasn't safe to feel. But it can also just lead to this person who has a really hard time shutting down, but isn't able to connect to how they really feel about things. And so we kind of think of it as a disconnection between head and heart. And then we have the phase 5 lateral bending. So this is a distortion in both the cervical spine and the pelvis, and it can look like a scoliosis within the spine, but the dominating consciousness of it would be anger itself, lack of action, thinking that this is just the way it will be. It's not going to change. There's just this kind of lack of possibility thinking. But yeah, that will look like a scoliosis often in the spine, or at least a lateral bending pattern. And then we have the phase 5 of extension and flexion, meaning this is like when you see that poor old lady in the grocery store and they're really hunched forward and their head is really out and their coccyx is really tucked under the rest of the body. That is what we think of as a phase 5 C5 coccyx pattern. Dominating conscious is just like victim mentality. Things just keep happening to me. I have no control. Realize that I'm giving you kind of a brief overview of the main patterns, but there's so many others that we work on. But these are the main ones, and there's offshoots of all of them because there's so many different things that can show up in our physiology. But what happens is that we each have a dominant phase. That dominant phase can really influence how we see the world. It can really influence how others see us. And the thing to know about it though, is that when I work with people and when Dr. Scott works with people, it's like working with an onion. So we might peel off one layer of like short-term stresses that have happened during the day, things that the nervous system has processed, but typically we're going to get to the dominant underlying phase in that adjustment process. But things change in people's lives. So we might have like an injury that happens, or we might have like a big stressor in someone's life, and we're going to see different patterning show up, and we're going to work with that pattern. And then we're going to probably most likely get back to the dominant phase that's underlying all of that. So as we're working and we're analyzing what's happening, things are shifting in the nervous system in response to every single contact that we make. And so then we look again, we analyze where are things at. Are we back to the dominant phase, or we have other things that need to be addressed? So it's a very fluid process. And because what we're adjusting is the nervous system, things are changing rapidly as we're working. We see those patterns shift, leg lengths change, or a dissipation of tension within the bone or the muscle, or an area where heat arises, or someone might get really cold during their adjustment. But these things are changing and adapting as we're working through the process. But this is the cool thing. So as someone gets to higher levels of care, so they start to develop the somatorespiratory wave, or they're moving towards the somatopsychic wave. As the neurological tension levels dissipate, people have better healing strategies, and they're able to connect with the good parts of their phase. So I am a major phase 4 pattern. That is my dominant patterning in my body. And so the cool thing about that is I've gone from a person who could not shut off, could not stop thinking, could not stop doing, to someone who can meditate all the time. I can sit in a chair, I can shut my mind down beautifully. I can journal and connect to how I feel. There's so many strategies that I've developed as my body has become healthier and more adaptable that are the gifts of everything that I've worked through with NSA care. So what I mean by that is that we don't expect like someone with phase 2 C1 to feel overwhelmed their entire life. We expect to see that, yes, that might be their go-to place in stress, but they have awareness that develops that they're able to shift in and out of that patterning so that their body can move to places where they can feel that peace for longer and longer time periods and tap into it more and more within their lives. It doesn't have to remain a tough, difficult thing to deal with. That adaptability happens the more neurological strategies they develop and the more awareness they develop. I'm going to just touch on biofields very quickly, but when you see us work, you may see that sometimes our hand comes, like if this is someone's spine, we may be away from the spine and come towards the spine. And so what happens is, if you noticed when I was working with Scott earlier, my hand might be up here and his body starts to stretch towards that. There is an awareness that develops in the biofields that are further out from the actual body itself. And so as the nervous system becomes more resilient and adaptable and more aware, it actually, and more complex, it has a greater awareness of what's happening around it. And so we think of like around our body is our physical, then we have our emotional biofield, our mental biofield, and then the spiritual biofield. The biofields, it used to be like, I remember when we first started teaching classes, like this is almost 20 years ago now. So people would think like that we are absolutely crazy. Now it's in journals. Biofields are like what you feel like when you encounter a really angry person, and they might be across the room, but you can feel that. You're feeling their biofield. You're tapping into, you can feel their emotional biofield. Your emotional biofield can become sensitive enough to be able to feel that. And a lot of people are born with those abilities as well, but with NSA care, we become more aware of our environment and how our body is responding to the environment. So how I would always say that is, would you rather sense a lion by its breath or by its roar? We would much rather sense the lion by its roar when it's really far away from us, not when it's breathing right next to us. So we want to increase the adaptability and the complexity of the nervous system so that we can increase our ability to tap into our biofields. I'm going to very quickly go through the stages, but the stages, we'll go back to this, are beautiful because they create such an acknowledgement. And so when you think of stages of healing, we all have specific places where our thought process goes in different parts of the healing process. And so Donald Epstein wrote a book called The 12 Stages of Healing. And the 12 stages are, again, basically the different places that we go in terms of our thinking or emotions as we move through a healing process. And what working with, so this is tied into what I'll show you a video here in a minute, but is a process called somatorespiratory integration. So body breath integration. And what it's involved with is that when you can acknowledge what's happening within the body and almost meet like a rhythm of what's happening within the body, it's that acknowledgement is going to create a movement, meaning that maybe even the difficult emotion can move versus prolonging the suffering process. So I'm going to briefly go through the stages of healing, just the first three, because they're the most common. But stage one has so much to do with an awareness of suffering or pain or feeling disconnected. The physiology of that is high tension, high fight or flight areas of the body. So this is, again, where most people start care in our office. The consciousness that's related to this is this ever going to end? How did this happen to me? And I shouldn't even say this is usually a step before people start care in our office. They often are just so frustrated and in such a down place, and there's very little energy to this place. But if we go to a place where we just try to disconnect from that feeling and don't acknowledge it, it grows. And so you may go in and out of stage one through different parts of your day that are difficult. Our goal is to move into stage two, or a different higher level of energy. So this is what stage two is. Stage two is the awareness of different rhythms that are a part of one system. So what that means is we have now, when we start to move into phase or stage two, we have increased breath through the system. We have an increase of parasympathetic nervous system activity. The consciousness of this now is like, well, what can I do to make this better? And so this is honestly where most of America kind of fluctuates, is between stage one of healing and stage two of healing. Stage two of healing is when you see drug ads and they have like that whole list of side effects, but they show the beautiful, like happy people that feel wonderful because of the drug. It's a higher level of energy than this is horrible and why is this happening to me? Higher level in stage two of energy, which we would consider a higher rhythm, is that there's energy like to, how can I fix this? This is where most people come into our office is, I need help. How can I fix this? And then we have stage three, making the mind-body connection of where you are stuck mentally and physically. What is so fascinating about working with anybody, with people in general, and watching my own behavior is that most of us move between stage one and two all the time. And so, but if you can get enough energy, you can move into stage three, which is like, I realize that I'm really stuck in this pattern and I want to change. So that there's like a momentum building. We have enough energy to actually create change. So with in the NSA care and with the somatorespiratory integration, we create and build more energy in the system to move beyond, so into like stage 4, stage 5, stage 6, higher levels of energy, higher levels of motion. But when you start to develop higher levels of energy, you develop more fuel, and that fuel allows you to make bigger changes within your life. So that's really the big goal of what we're looking at. But it's having to get to the point where you can actually acknowledge what's happening within your body. And that's what somatorespiratory integration and the stages of healing are all about. So I'm just going to very quickly show you G's video here. She's our somatorespiratory integration practitioner in the office.
Hey guys, Jay at Body and Balance Wellness Center here to chat with you a little bit more about how SRI can support you in your healing journey along with Network Spinal Analysis. As we know, we store tension and stress within our body, and what NSA can support you with is to helping release that tension out of the system. And as the tension releases, along with it can come the emotional aspects of it. So a lot of the time people start to wonder, why is this happening to me? Why am I, processing this information from so long ago? And, what do I kind of do from here? And so what a SRI allows for is it really allows you to connect in with the physical experience of the emotion. And when I say the physical experience of the emotion, for example, is when you experience sadness, it feels really heavy. There's a really low energetic tone to it. You're not really motivated or can't really focus on much else. And you may kind of just want to shelter in and kind of protect yourself. It's kind of a vulnerable state to be in. And on the other side of that, there's happiness and excitement, maybe some anxiety as well. Those are kind of more higher energetic state.
See if I can get that back.
Emotional experiences, and your body temperature might increase, and your heart rate might increase, and you might notice you may want to move your body a little bit more. So those are kind of higher energetic states of physical emotions. So what SRI allows for, when you start to understand the wide range of your physical emotions, is it allows for more adaptability and resiliency. It allows for you to be really connected in with your body as you come across daily stressors. And if you're looking for more information and more support, please reach out to our team. Let us know. We also have resources on our website and through our social media outlets.
Okay. So anyway, there's somatorespiratory integration is an amazing tool that helps people move through the stages of healing. So it is amazing the results that we see with clients when they can actually acknowledge what they're feeling in their body, but also again, kind of move that, let that shift out of their system so that they can experience other emotions or gather more information. So fascinating. So in the big picture, we're going to be doing classes in this in the future, but we're going to really talk about reorganizational healing because we want the whole system to become adaptable, resilience. We want advancement for the nervous system so that your life, not only can you have that increased sense of well-being, but also be able to handle things in a way that is really allowing you to get to the root causes and make changes that in your life that are healthy and positive. And then we want the development of the somatopsychic wave. It's a really powerful thing to experience within your own body, but it's also something that can make some really significant shifts in your life and well-being. So I want to thank you so much for being here. I hope again, this is the first time we've ever done this class online. So please put any questions that you have into the Q&A box so that I can make sure that we address them and talk about those things. And I will make sure that I get a picture for the dorsal horn so you can see what part of the spinal cord canal that is, or the spinal cord. I just want to remind anybody that we have our Community Appreciation Month offer right now. It's the best new patient offer that we do throughout the year. So it includes someone's consultation and exam, their report to go over all their results. It also includes their first adjustment. It's all for $29, the only time of the year that we do all that. for $29. So make sure you call the office if there's someone that you know that needs to schedule or that you want. Make sure you share that information with them. And our mission is the mission of Body and Balance is to inspire clients to awaken to their highest potential by improving physical, emotional, and mental well-being, allowing our community to express vibrant health. So I'm going to open it up and just see if anybody has any questions that I can help with. But otherwise, I hope the information was helpful. I hope it allows you just to pay attention to your body, move whenever you feel like it, will help you through the process. So I hope that all that is giving you good info. Thank you so much for the feedback. Anybody else? Questions? Okay. Well, thank you so much for attending tonight. I appreciate your time. I know everyone's very busy, but I hope this adds to your care and enhances things. So thank you so much and have